weighing around 8.5 ounces. This week, your baby's skin is getting thicker and more opaque, and you may even be able to see tiny veins underneath. Your baby's ears are also fully formed, and they can now hear your voice and other sounds from outside the womb. Your baby's brain is developing rapidly, and the neurons in their brain are now forming more complex connections. This means that your baby's movements are becoming more coordinated, and they may even start to play with their umbilical cord. Your baby is also starting to develop more defined facial features, including eyebrows and eyelashes. Now, let's talk about the symptoms you may be experiencing at 19 weeks pregnant. By this point, many of the early pregnancy symptoms have subsided, and you may be feeling more like yourself again. However, you may still be experiencing some common symptoms such as Braxton Hicks contractions. You may start to feel mild contractions in your uterus as early as the second trimester. These contractions are completely normal and help to prepare your body for labor. Increased appetite. You may find that you're hungrier than usual, especially as your baby's growth requires more energy. Back pain. As your baby grows and your belly expands, you may start to experience back pain. This is due to the extra weight you're carrying and the changes in your posture. Swollen feet and ankles. You may notice that your feet and ankles are starting to swell, especially if you've been standing or sitting for long periods of time. To reduce swelling, try elevating your feet whenever possible and wearing comfortable shoes. Skin changes. You may notice that your skin is becoming more sensitive or that you're developing new stretch marks. These changes are normal and can be managed with moisturizers or creams. In conclusion, at 19 weeks pregnant, your baby is growing and developing rapidly, and you may be experiencing some common symptoms like back pain, swelling, and skin changes. It's important to continue taking care of yourself by eating a healthy diet, staying active, and getting plenty of rest. Remember to schedule your next prenatal appointment with your healthcare provider and ask any questions or concerns you may have. Thank you for watching, and we'll see you in the next video. Hello and welcome to this video on 20 weeks of pregnancy symptoms and baby development. At 20 weeks, you're halfway through your pregnancy and your baby has reached an exciting milestone. So, let's dive into what to expect during this stage. Firstly, let's talk about the baby's development. At this stage, your baby is about the size of a banana, weighing around 10 ounces and measuring around 6.5 inches in length. They are now fully formed and all their major organs are in place. Your baby's skin is still thin and translucent, but they are beginning to develop a layer of fat to help regulate their body temperature. One of the most exciting developments during this stage is that you can now feel your baby's movements. Your baby is becoming more active and you might feel them kicking or moving around. As your baby grows, their movements will become more defined and frequent. Now, let's move on to the symptoms you might experience at 20 weeks of pregnancy. Firstly, many women experience increased appetite during this stage. 2. You may feel like you're constantly hungry and need to eat more often. This is because your body needs more energy to support your growing baby. Another symptom you may experience is heartburn or indigestion. As your uterus expands, it puts pressure on your stomach, which can cause acid reflux. To reduce this, try eating smaller, more frequent meals and avoid spicy or acidic foods. You may also experience some mild swelling in your feet and ankles. This is because your body is retaining more water during pregnancy. To reduce swelling, try resting with your feet elevated and avoid standing or sitting for long periods of time. One of the most common symptoms of pregnancy at 20 weeks is back pain. As your uterus grows, it puts pressure on your back and can cause discomfort. To reduce back pain, try using a pregnancy pillow to support your body while sleeping and avoid lifting heavy objects. Finally, you may experience some mood swings or heightened emotions during this stage. This is normal as your body is going through many changes, and it's important to take care of your emotional well-being as well as your physical health. In terms of prenatal care, it's important to attend all your scheduled appointments with your healthcare provider. At 20 weeks, you will have an ultrasound to check on your baby's growth and development. This is also when you may find out the sex of your baby if you choose to. In summary, at 20 weeks of pregnancy, your baby is fully formed and developing rapidly. You may experience symptoms such as increased appetite, heartburn, swelling, back pain, and mood swings. It's important to attend all your prenatal appointments and take care of your physical and emotional well-being. Thank you for watching this video on 20 weeks of pregnancy symptoms and baby development. We hope you found it informative and helpful. If you have any questions or concerns, please consult with your healthcare provider.
Introduction. Greet your viewers warmly. Briefly share your excitement about documenting your pregnancy journey. Week 4-6, Discovery. Discuss how you found out about the pregnancy. Share your initial thoughts and emotions. Week 7-10, First trimester symptoms. Detail common symptoms like morning sickness and fatigue. Offer tips on coping with these symptoms. Week 11-13, First ultrasound. Share your experience with the first ultrasound. Discuss any surprises or emotions during this appointment. Week 14-16, Gender reveal. If you've discovered the gender, reveal it to your audience. Share any creative or special gender reveal ideas you used. Week 17-20, Second trimester milestones. Discuss improvements in symptoms. Share any notable milestones, like feeling the first kicks. Week 21-24, Maternity fashion. Showcase your favorite maternity outfits. Offer tips for staying stylish and comfortable. Week 25-28, Baby shower preparation. Discuss planning and organizing your baby shower. Share any memorable moments from the celebration. Week 29-32, Third trimester challenges. Address common challenges like back pain and sleep difficulties. Offer advice on staying comfortable during this stage. Week 33-36, Nesting and preparing. Show your audience how you're preparing for the baby's arrival. Discuss any nesting instincts or rituals you've experienced. Week 37-40, Final countdown. Share your thoughts and emotions as you approach your due date. Discuss any last-minute preparations or anxieties. Labor and delivery. Document your labor experience as much as you're comfortable. Share your feelings and reactions during the delivery. Welcome baby. Postpartum. Introduce your newborn to your audience. Discuss your postpartum experiences and emotions. Conclusion. Express gratitude to your viewers for joining you on this journey. Share your plans for future videos or updates on your growing family.
C-Section Recovery Guide, 20 Essential Tips for New Moms. 1. Introduction. Start by welcoming viewers and acknowledging the commonality of C-sections in childbirth. 2. Immediate post-op care. Discuss the importance of following medical advice for wound care and pain management. Highlight the significance of rest and limited physical activity in the initial days. 3. Incision care. Explain how to clean and care for the incision site. Stress the significance of keeping the incision dry and watching for signs of infection. 4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding and when to seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending postoperative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice.
Teenage pregnancy is when a female under the age of 20 becomes pregnant. It is a global issue that affects millions of teenagers every year. Teenage pregnancy can have serious physical, emotional, and social consequences. It is more common in low-income communities, where access to contraception and education may be limited. Lack of knowledge about sexual health, contraception, and healthy relationships can contribute to teenage pregnancy. Teenage mothers are more likely to drop out of school, which can limit their future opportunities and earning potential. Teenage fathers may also face financial and social challenges as a result of the pregnancy. The rate of teenage pregnancy has been declining in many countries, but it remains a significant problem in some regions. Provide education, counseling, and access to contraception have been effective in reducing the rate of teenage pregnancy. Support for teenage parents, including medical care, childcare, and education, can help mitigate the negative effects of teenage pregnancy.
Journey through the stages of pregnancy. Objectives. Define the three main stages of pregnancy: the first trimester, second trimester, and third trimester. Identify and describe the approximate duration of each pregnancy stage, including the weeks and months. Explain the physical and hormonal changes that occur during each pregnancy. What is pregnancy? Pregnancy is a biological process in which a woman's body nurtures and develops a fertilized egg, leading to the growth and development of an embryo and fetus inside the uterus. It occurs when a sperm cell fertilizes an egg, resulting in the formation of a zygote. The stages of pregnancy are typically divided into 3 trimesters, each approximately 3 months long. Throughout pregnancy, the fetus grows and develops, forming tissues and body systems. The average duration of pregnancy is around 40 weeks, calculated from the first day of the woman's last menstrual period. First trimester pregnancy. Pregnancy weeks 1 to 4. Fertilized egg travels down the fallopian tube and implants into the uterine lining. The fertilized embryo begins to form and consists of a cluster of cells. Development of the neural tube, which will become the brain and spinal cord, begins. Formation of the placenta connecting the embryo to the mother's bloodstream. Pregnancy weeks 5-8. The embryo grows rapidly. Basic features of the baby begin to take shape. The umbilical cord forms, connecting the baby to the placenta. The neural tube closes, marking the completion of the baby's spinal cord. The placenta grows and takes on a crucial role in pregnancy weeks 9-13. Major organ systems have formed, and the baby's structure is more defined. The fetus develops fingers and toes, which are initially webbed but begin to separate. Facial features become more distinct, and the eyes may move closer together. Muscles develop, allowing the fetus to make spontaneous movements. Second trimester, pregnancy, weeks 14-17. Many of the major organs and body systems functioning or nearing functionality. Fine hair called lanugo begins to cover the baby's body to provide insulation. Bones continue to harden and muscles develop, enabling coordinated movements. The baby starts to practice swallowing and can even suck its thumb. Pregnancy weeks 18-22. The baby experiences a substantial growth spurt with an increase in size and weight. The baby's senses continue to develop, and it can now hear sounds from the outside world. The skeleton continues to develop, and the bone marrow produces red blood cells. A waxy substance starts to form on the baby's skin to protect it in the amniotic fluid. Pregnancy weeks 23-27. The baby's growth continues at a rapid pace, and their body becomes more proportionate. Lungs continue to develop, and respiratory movements, such as practice breathing, occur. Skin becomes less translucent as fat deposits start to develop beneath the skin. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Third trimester, pregnancy, weeks 28-31. Brain development progresses, with the nervous system becoming more complex. The baby's position may shift, with the head typically moving downward into the pelvis. Movements may be more vigorous as they have limited space in the uterus. Organs continue to mature, increasing their readiness for independent functioning. Pregnancy weeks 32-35. The baby gains more weight, accumulating fat layers under their skin for energy reserves. The baby's head settles deeper into the pelvis, positioning itself for delivery. Organ systems further mature and develop in preparation for life outside the womb. Movements may feel more restricted due to increasing size and limited space. Pregnancy weeks 36-40. The baby's growth slows down, but they continue to gain weight and size. The baby's head becomes engaged in the pelvis, settling into a position for birth. The baby's organs are fully developed and ready for independent functioning. The baby's bones and skull remain flexible to facilitate the birthing process.
Start with a warm welcome and a brief introduction to the topic. Mention the importance of understanding ovulation for those trying to conceive or practicing contraception. Point 1. Know your menstrual cycle. Explain that ovulation occurs in the middle of your menstrual cycle. Discuss the typical menstrual cycle length, which is around 28 days, but can vary. Emphasize that tracking your cycle is essential. Point 2. Start with day 1. Explain that the first day of your menstrual bleeding is considered day 1 of your cycle. Point 3. Calculate your cycle length. Instruct viewers to record the number of days between the start of one period to the start of the next for a few months. Highlight that cycle length can vary and may not always be the same. Point 4. Determine your ovulation window. Mention that the ovulation window is usually around the midpoint of the cycle. To find it, subtract 14 from your average cycle length. For example, if your cycle is 28 days, subtract 14 to get 14. Your ovulation window is around day 14. Point 5. Use ovulation prediction kits. OPKs. Explain that OPKs can help pinpoint ovulation more accurately. Describe how to use OPKs by following the package in Point 6. Monitor basal body temperature. BBT. Discuss how a woman's basal body temperature rises slightly after ovulation. Instruct viewers to use a basal thermometer and take their temperature every morning before getting out of bed. Point 7. Track cervical mucus changes. Explain that cervical mucus changes in consistency throughout the menstrual cycle. Describe how to observe and record these changes. Point 8. Pay attention to ovulation symptoms. Mention common symptoms like mild pelvic pain, breast tenderness, or heightened senses. Stress that these symptoms are not definitive but can be additional indicators. Point 9. Keep a ovulation calendar. Encourage viewers to create an ovulation calendar. Use a calendar or a smartphone app to track cycle length, OPK results, BBT, and other relevant data. Point 10. Be patient. Remind viewers that it may take a few months of tracking to accurately predict ovulation. Highlight the importance of patience and persistence. Conclusion. Summarize the key points discussed in the video. Remind viewers that understanding their ovulation cycle can be helpful whether they are trying to conceive or manage contraception. End with a call to action. Encourage viewers to subscribe, like, and share the video. Invite them to ask questions or share their experiences in the comments section. Hey there, lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance. Excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for all women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine intake has been linked to reduced fertility, so consider cutting back. Point 5. Preconception health check with your doctor. Discuss any pre-existing conditions, medications, or supplements you're taking that could impact fertility. Point 6. Stay hydrated. Drinking enough water helps maintain healthy cervical mucus, which plays a role in fertility. Point 7. Timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8. Communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. If you're having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion. Thank you so much for joining us today as we explored these comprehensive tips for increasing your chances of getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. This stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is, as your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources